afternoon to you all. It's really a privilege to be here, because it's after a long time, after 2 years or more than that, that one is meeting physically. We've become so virtual that every time now my engagement writes in person. When it is not in person, then I assume it is virtual. So virtual has become the order of the day. So it's always great to be with friends, have a cup of coffee, have a cup of tea, converse freely. So that's really a great thing. Let me first compliment and thank Mint for inviting me to this conference. I must also compliment them for organizing this AI summit. Are two words which are very, not only they are fashionable, they are also actionable, in the sense that they are really have a tremendous transformational power. Seldom do technologies have, information and communication technologies have changed the way we think, we do things, and the communications, for example, again is another sector which has been extremely dynamic, and it has really changed the way we live, we communicate, we interact with people. And AI is also going to be extremely transformative. Now, when I was coming, I was being told, which topic would you like to speak on? And I said, look, I am not an AI expert, honestly. I do coding, but that coding is a coding of yesteryear. AI is not the deterministic coding, where you plug in the rules, you plug in the data, and you have an outcome. AI is much more probabilistic. AI is much more, sort of self-learning kind of stuff. So it's much more complicated than the simple code, which I am familiar with. So I'm not really an expert on AI, and I'm not going to speak on that. But I'll sort of share my experience of how India is enabling itself, or India is going to enable itself for use of AI. Because my view is that AI is going to work on digital data. AI is not something which you can apply on any situation. So unless you have a huge amount of data being generated out of systems, that is a prerequisite for application of artificial intelligence and deriving some meaningful predictive and other kinds of decision support systems. So that's something, and I want to share with you that India has done tremendous amount of leapfrog in generating that kind of data, and also putting in place systems, which actually are like building blocks of various kinds of solutions. So one is, I like to begin with Digital India program of the Prime Minister. Now, in 2014, the Honorable PM announced the Digital India program, and I happened to be the secretary of the IT department there at that time. And I also had some role to play in articulating that vision. And the vision of Digital India was to transform India into a digitally empowered society and knowledge economy. And the whole idea was that how do we progress to ensure that we achieve that objective of digital economy and empowered society. So one is that we focused on digital infrastructure as a utility to citizens, which is basically the connectivity infrastructure. Because unless you have connectivity, you are not going to have any kind of digital systems. They are not the, internet and connected systems are the order of the day. And I'm happy to say that in the last 7-8 years, we have tremendously gone ahead, and we have leapfrogged in connectivity. Imagine in 2014, we had the data price at 275 rupees per gigabyte. The networks were all, 2G, 2.5G, 3G, 4G, that kind of networks. Today we have the data price at 7 rupees per gigabyte. 274 to 7. We have 4G connectivity throughout the country. The average data consumption is 12 gigabytes per person per month. This is a couple of times higher than the average data consumption on mobile networks in America. In fact, our networks are transporting more data Then the mobile networks, and I'm talking of mobile to mobile comparison, please don't get me wrong. Fixed lines are not really our strength. Our networks are transporting more data than the data transported by the mobile networks of US and China put together. You'll be surprised to know. So this is we have really, and there's hardly a couple of thousand villages, very remote villages, which are not connected to 4G connectivity. So the 4G, today, India is the only country where people are watching films on mobile. Data is so cheap. And that's how we are actually really digitally connected, though of course not through a fixed line, and you still have problems of call drops or other kinds of unreliable stuff, but nevertheless we have a workable connectivity. Then we talk of second layer was creating software and services on top of this digital infrastructure, which we have created. We have a number of artifacts like Aadhaar, the digital identity system, which is the largest in the world. And just to give you some statistics, Aadhaar offers a service called authentication. And we have had 65 billion authentications thus far, 65 billion. We offer what is called electronic KYC. And we have 9 billion electronic KYCs, which are used for, mobile SIMs, which are used for opening bank accounts, which are, authentications are used for delivery of ration. So this is the digital infrastructure we have created, the soft infrastructure. We have the unified payment interface, the payment infrastructure, which is actually, last month I was told the total transactions on UPI were 5.4 billion. Imagine, 18 crore people, 18 crore transactions take place per day. 5.4 billion means 540 crores per month. And it is free. I mean, many of you must have transferred money, overseas, and the Western Union money transfer and stuff like that. They charge a couple of percentage points on the money. Now we have, if I transfer 1 rupee to Leslie, it will be 1 rupee only, not even 99 paisa. So this is the infrastructure which we have created. We have created frugal, interoperable, society level, scalable infrastructure. CoWIN is the recent example where India has created that infrastructure. We have, every injection, every vaccine is accounted for. You have a digital certificate. About 2 billion doses have been delivered. India has had an extremely successful vaccination program where everybody, there was no rent seeking, there was no confusion. It is a complete, total absence of information asymmetry. There was no information asymmetry. A VIP was also looking at the same dashboard, same, which hospitals are available. Even a poor man was looking at the same. So this is what we have created by way of software and services on demand. Then we created citizens empowerment, basically the common service centers, which are large number. So essentially what I am trying to say is that India has enabled the data economy, the data play at a scale which is the prerequisite for applications of artificial intelligence. So for example, just to give you one example, on the UPI, we are now creating a concept of data aggregator. What is a data aggregator? The data aggregator or the account aggregator is actually a data fiduciary which will make the algorithmic credit to people available. Because if you want, India is a country where you have a very small sachet size and very large volume. This is the characteristics of our transactions, where you have 100 रुपए का transaction है और लेकिन हो गए 54 crore transaction. This is the characteristics, and therefore for such kind of systems to succeed, they have to be completely, the cost of transaction has to be almost zero. Then and only then they can sustain. अगर मान लीजिए हम आपको 1000 रुपए का लोन दें और उसके लिए वेरिफिकेशन में हम 100 रुपए का बर्बाद कर दें आपको कस्टमर एक्विजिशन में 200 रुपया, that loan itself becomes unsustainable. Now if that can be made digital, completely algorithmic, completely AI based, then this will work at a scale. So now you have PM Swanidhi. We have a number of programs where algorithmic kind of loan giving loan to people. They can electronic KYC, faceless, presence-less KYC, and thereafter, giving their transactions or giving their, because poor people don't have a credit history. You can't support this kind of that I have had loan from this person and I have been very responsible creditor, the loaner. That will not happen. Basically, what is required is somehow digitize this entire value chain so that the whole thing becomes nobody is there, no human being is there. Every decision is being taken by algorithms of the artificial intelligence. That is how it is going to happen. And this is going to certainly transform. There are many, sectors in which agriculture, education, health. And let me talk about health as to how we are, using the artificial intelligence even at this point in time and how we propose to take it further. So one is that the NHA, which I am working with, supports two programs. One program is called Ayushman Bharat PMJAY, Pradhan Mantri Jan Arogya Yojana, where each poor family is given an envelope of 5 lakh rupees per annum, which means that they have an insurance of 5 lakh for hospitalization, for serious diseases. Why it is for hospitalization and why not for OPD? The reason is that many times the poor people get into the deep pit of the poverty once they get sick with serious diseases, and therefore the out-of-pocket expenditure should not happen. That's the broad purpose of ABPMJY. And for your information, we have done 3 crore hospitalizations in the last 3.5 years that the scheme has been in existence. So it's actually, we are processing 1 million claims per month. That's the average which we do. And I think what is going to happen is, and for your information, this entire claim processing is completely paperless. From the pre-authorization at the hospital level, the authentication at the hospital level, claim submission, claim processing, payment to the hospital, everything is digital. And then you can imagine 1 million data points, how valuable this data is. And that data, if you start using it, not misuse it, obviously, using it in an anonymized manner and using it, you can derive huge amount of public policy, health policy related implications. That's one part. India has also created digital public goods during the last 7-8 years. One is electronic KYC, digital signatures on demand called e-sign. We have consent artifact. We have a number of digital goods. We are creating another digital good, which we called health claims exchange, which means that the health claims exchange will work like a pipeline where you can put in the claims and the claim object form in a standardized form. The providers can put in the claims and the payers can then pay these claims. So this will actually reduce the cost of processing of transactions by the insurance companies, even private insurance companies, not the Sarkari, the one which we are having in the PMJY, but even otherwise also a Star Alliance and all these companies where you have Mediclaims and many policies. That part will also become extremely easy. So that's something which we are utilizing, and this health claims exchange will use the entire AI principles to do a predictive analysis, to do a fraud detection on these claims as to whether the claim is a fraudulent claim or a non-fraudulent claim. Those kinds of things will happen. And currently also we are using AI and learning. AI triggers have been created to say that if a claim is submitted, whether this claim is suspicious claim or a non-suspicious claim. So this is something which we are going to strengthen, and not only we are going to use for NHA, we are also going to give it to the country as a digital public goods which can be used, and it's an open source, interoperable, similar to CoWIN. That's what we are. CoWIN, as you know, there are 150 partners which are linked with us on CoWIN. Paytm is doing a booking of hospitals for CoWIN vaccination. Infosys, Apollo hospitals, Max hospitals, Make My Trip. Everybody is connected with CoWIN. Similarly, this is what we are going to do. We are going to create this platform, and then claims will be submitted and claims will be able to be processed. The other part which we are doing here, and which the Prime Minister launched last September, is Ayushman Bharat Digital Mission, which is essentially leveraging the power of digital technologies to deliver better healthcare services. More affordable, more ubiquitous, more accessible, and quality. All these three parameters of healthcare service delivery are the objective function of this program. And the whole idea is, how can you achieve all these three desirable achievements, which is the quality, affordability, and access, by using digital technologies. Now, all of us know that COVID has been an extreme disaster for the whole world. But one positive aspect of COVID has been the basically use of digital. We all do now video conferencing, we all do video calling on WhatsApp or on some other method, we consult our doctors, we do online shopping, we do online medicine delivery, especially in COVID when you had those quarantine periods. Now that is something, in fact the 5.4 billion UPI transaction itself is a testimony to the fact as to how digital has increased, because before COVID the numbers were much, much smaller. So this part, actually we are going to leverage this part and we are going to formalize this. So couple of things. First of all, patient or the person or the individual will be at the center of this entire architecture. So we have created what is called personal health record situation, where we allot a number, an account number called Aadhaar number, Ayushman Bharat health account number. That health account number will be the number used to link all his or her health records. Past also you can link, and future when you interact with the health systems, whether you get a report, your blood report or other reports, you will be able to link that. So that's one part which is operational. Second is, we are creating what is called health facilities registry. We are creating drug registry. Health facility registry means the health providers registry, which is the laboratories, the hospitals and other things. The drug registry, which is basically the drugs, the entire drugs which are available. The health professionals registry, which is doctors, nurses, paramedical staff, etc. So these are the building blocks which are being created and which are going to interact in a way that the patient will be able to have his or her longitudinal health record. He or she will be able to share with consent with the doctor, and he or she will be able to do video consultation with the doctor. Video consultation which will be paid, because currently you send to your doctor some message saying that mujhe dawai ka daam bata dijiye naam. He sends out this thing, and the doctors are also very unhappy कि मेरा pocket में कोई पैसा नहीं दे रहा है और ऐसे ही दवाई का नाम पूछते जा रहे हैं लोग. Now we are saying, bhai, sabko, everybody is service provider should also be benefited out of this. So I think we are having that, video consultation, and there are a number of applications which are already been rolled out. So all the building blocks are ready. We are also putting the AI systems, because as you know, AI has done a wonderful work in the healthcare diagnostic space. When you put an MRI and then you can have a second opinion, and they will be able to tell as to what is the real problem. So the machine does much better analysis than probably human beings in some areas. So this is what we are going to do, is we are going to invite these expert systems and these AI systems to put their solutions on this platform, so that rather than purchasing those systems, we will, from an OPEX model, we will make it a CAPEX model, which means you don't purchase the systems are available, and you use software as service. So you plug in your MRI report, a doctor plugs in the MRI report and then result and pays the money, whatever is required for per transaction basis, and the result comes out. So this is the way we are going to use all these experts and AI systems to make this happen. So essentially, what is going to happen is that the digitization of the Indian health space is going to be accelerated. Now, what I'm saying is that, look, the technology is all there. The framework is created. But now the application and use of that technology must take place. And with this audience, I would like to urge that the sooner we use it, because ultimately adoption of this technology is not in my hands. Adoption is in the hands of, the laboratory, the hospitals, the doctors, the patients, everybody. Sometimes people say that आपने आधार किया तो आपके लिए ये क्या मुश्किल है. लेकिन let me share with you something which I don't want to disparage or minimize the effort put in Aadhaar. But let me say this project is much more difficult to implement than Aadhaar. Why? Because Aadhaar, there were only two stakeholders. One was the person, the citizen, who was looking for a verifiable identity. Many citizens did not have a verifiable identity. So individual verifiable identity. So he wanted that card or whatever, that individual number. And there was government who were having money and to enroll people and provide that identity. So there were only two people, and there was a bipartisan support for that effort across the nation, and therefore it happened. And of course, technology was the difficult part, but that was solved. Technology is always easier to solve and easier to put. Technology is not the most difficult part of the problem, often. That was solved. Here, you have the building blocks ready. Now, what is required is basically acceleration of its adoption. Now, patient will have to realize that अगर मान लीजिए मेरे पास मेरे सारे health records होंगे available, which I can share with the doctor, my diagnosis will be much better, much quicker. डॉक्टर साहब ये नहीं बोलेंगे कि जाके ब्लड का एक नया टेस्ट करवा के ले आ. अगर मान लीजिए मैंने ब्लड का टेस्ट 2 महीने पहले करवाया है, then I can show that and say, भाई मेरा ये टेस्ट already है, why should I go and spend further money on that? So essentially, this is the adoption problem, which actually is benefit the patients, it will benefit the doctors, it will benefit the hospitals, and overall it will benefit the country, because the kind of digitized data we will get out of it will be really invaluable, and we can put all kinds of AI systems into place. Obviously, the AI also has to have certain restrictions and limits, and I'm sure your experts must have discussed it. Ethics and AI must be ethical. Algorithms must be explainable. The person who is putting the algorithm must be accountable. So all these explainability, accountability, and it should be for public good. It should not be, harming people. It should not happen that, you are misusing somebody's data just because the poor fellow is an illiterate person. That should not happen. So therefore, all these regulations which have been put in place, OECD, as you know, has come up with the regulation. The European Union has come up with regulations. There are multiple, domains which are actually have come up with certain guiding principles and the basic desirable attributes of AI systems which are used for public, purposes. And I'm sure your experts must have discussed this. But what I'm saying is, this will provide a huge amount of public policy inputs to the government and policy makers. We will be able to do a much more predictive model of, the disease, how it is developing, the non-communicable diseases, what is the pattern, what should we do. So I think there are multiple dimensions of this artificial intelligence into this digital systems. So I see our goal and the India's goal as, now we are doing multiple things, by the way. We are doing one thing in the health, which is the Ayushman Bharat Health Digital Mission. We are doing something in the digital commerce space also, and which is the open network for digital commerce. We are doing something in the tourism space. Now, what is happening is, because we have these digital artifacts, the Aadhaar identity, the payment system, the electronic KYC, etc. They are the building blocks of building new systems. And those systems are now being built in domains. Domain of health, education, agriculture, commerce. This is what is going to, believe me, these are something extremely, beautiful, not only concepts, but something new is being done in this country. The model which has become prevalent is basically the digital players. The digital space is winner takes all situation. Imagine there is one Amazon, there is one Facebook, there is one Twitter, there is one Apple, there is one Microsoft. Who remembers that there was a social media platform called Orkut? Do you remember? It's just not there anymore. So what has happened? They all collapse into one. And why they do that? Because of the basic architecture. Internet belongs to everybody. I mean, India is very proud to say that we introduced net neutrality concept, which basically means that internet should be a permissionless free platform. Now, unfortunately, whatever has been built on top of internet basically has followed this winner takes all approach. And what India is doing is actually we are building a protocol-based approach. It's like, if I am buying on an Amazon, then I have to have Amazon application. The seller has to be on the Amazon platform, right? So it's a vertically integrated system. If I have to send a mail, I may be on Rediff Mail, you may be on Gmail, somebody else may be Hotmail. We are all exchanging mails freely. Why? Because it is based on SMTP. It's based on a simple mail transfer protocol, which is actually a protocol, which is a public good. That is why internet is not being owned by anybody, because it works on protocols. We are creating systems which are truly interoperable, which are not owned by anybody, but which work in a seamless, frictionless fashion. So we are building internet, part of internet on top of that internet, using the same principles of openness, interoperability, and societal scalability. So this is what is being done. I'm sure all the experts here and all the you will continue to participate in this digital journey, and I will be very happy to come again and again and again. Thank you very much once again for inviting me to this conference.